Panner disease is a harmless, temporary problem that affects the growth area epiphysis at the top of the elbow bone called the capitulum. It usually shows up in kids and teens who are still growing, especially those who love sports that involve a lot of arm throwing or swinging. Think of it as a small bruise inside the bone that heals on its own over time. The exact cause is not fully known, but the most common trigger is repeated stress on the elbow. Activities like baseball pitching, gymnastics, or weightlifting can gently crush the growing cartilage. Poor nutrition, or a sudden increase in training intensity, can also make the bone more vulnerable. Imagine repeatedly pressing a soft sponge with a heavy book. Over time, the sponge gets squished and may need a break to recover. Kids with Panner disease often feel a dull ache on the outer side of the elbow, especially after playing. The pain may make them avoid throwing or lifting. The elbow can feel stiff, and a slight swelling may appear. However, the skin over the joint usually looks normal, and there is no fever or infection. An easy way to check is to ask the child to point to where it hurts after a game. If they point to the outer elbow, it could be Panner disease. Doctors usually start with an X-ray of the elbow, which shows a softer, less dense spot at the capitulum. MRI can be used if the picture is unclear. Treatment focuses on rest, stopping the activity that caused the pain, using a sling or elbow brace for a few weeks, and doing gentle range of motion exercises. Pain relievers like ibuprofen can help. Most children recover fully in 6 to 12 months, and physical therapy helps them return to sport safely. The best way to prevent Panner disease is to avoid overtraining. Kids should follow a gradual increase in activity, take regular rest days, and use proper technique, for example, proper throwing mechanics. Strengthening the forearm and shoulder muscles and doing warm-up stretches before games can reduce stress on the elbow. Think of it like giving a plant enough water and sunlight. Balance prevents the plant from wilting. Recent studies have looked at early MRI screening for young athletes who report elbow pain, allowing doctors to spot Panner disease before it shows on X-ray. Some research also suggests that low-impact cross-training while the elbow heals can keep overall fitness up without stressing the joint. While these advances are still being tested, they show promise for quicker diagnosis and safer return to play plans.